Very good morning to all. I am Dr. Vijayakumar, Professor of Physiology. Belongs to Bharat Institute of Higher Education and Research. Today I am going to take about the thyroid gland, which is located in the neck of the human. The thyroid gland plays important role in regulating all over the functions of the body. This is the thyroid gland location. It is located just in front of the trachea, below the larynx, has two extension, and this picture shows the blood vessels which is supplied to the thyroid gland. Anatomy of the thyroid gland. It has the two distinction, first one and large one. That weighs about 15 to 25 grams. The thyroid gland lies in the anterior aspect of the neck, and the thyroid gland has two lateral lobes connected to by isthmus located over the trachea below the larynx, as I already told. And the blood supply is very high, and superior thyroid artery, inferior thyroid artery. Superior thyroid artery arises from the external carotid artery, and the inferior thyroid artery arises directly from the branch of aorta. This picture shows the enlargement of the thyroid gland and its blood supply. And the right side picture shows the histological schematic structure of the thyroid gland, which consists of colloid, capillary, follicular epithelial cells, and capsules. In between the follicle cells, there are C cells. And the colloid, which will be in the center of the follicle, which plays important role in the functions of the body. Now, this is a real histological structure of the thyroid gland, which shows the follicular cells, colloid, and blood vessels, capillaries. And the thyroid gland is made up of numerous follicles. The follicles are layers of simple epithelium surrounding a gel-like pinkish material called colloid. The principal cell is the most numerous cells present in the simple epithelial layer, secreting the thyroid hormone as well as the thyroglobulin, a glycoprotein. Thyroid hormones are stored extracellularly, part of the thyroglobulin, which is the main component of the colloid. And this picture shows the colloid, and in between the follicle cell, parafollicular cells, and major follicle cells with the principal cells. And inactive gland. The epithelium is flat, vesicle, large, filled with colloid with no vacuoles. Active gland. Columnar cells, vesicles are small and colloid with vacuoles near the edge. Parafollicular cells found as a single cells in the epithelial lining of the follicle. The parafollicular cells secretes the hormone calcitonin, which lowers the level of the calcium in the blood. Thyroglobulin. Thyroglobulin is a glycoprotein formed in the follicular cells, secreted into the colloid by the process of exocytosis. This colloid contain tyrosine residues which are in the contact with the follicular cell surface and the synthesis of the thyroid hormones. The thyroid is the first step of thyroid synthesis takes place in our body's iodide trapping. That is the iodide actively transported into the iodine part, and oxidation of the iodide to form the iodine by the process of peroxidase, the enzyme which is converts the or oxidize the iodide into iodine, and the iodination of the tyrosine forming the diiodotyrosine and monoiodotyrosine. Both diiodotyrosine and monoiodotyrosine join to form. The process is called coupling and condensed to form the T3 and T4, thyroid 3, thyroxine 3, thyroxine 4. Then, by the process of pinocytosis, thyroglobulin will be undergoes by the cell, and the proteolysis and release of secretion of hormones will be in the plasma, into the plasma. After this proteolysis and release secretion of the hormones, deiodination of the monoiodotyrosine and M-iodotyrosine, which will release the iodine, which forms the second iodide pool and recycled into the thyroid hormone synthesis. This picture shows the synthesis of thyroid hormone. Left hand side, you can see the layers of the thyroid follicular cells. Next to that layer, you can see the three green color particle are known as nothing but iodide. Iodide is present outside the follicle, will taken up into the inside the follicle. That is the iodide trapping. Iodide trapping, this process actively takes place. That is why previously I told active transport. Iodide is actively tracking or trapped into the follicular cells by the process of active transport to form active transport, and gets oxidized to form the active form of iodine. Easily you can see the picture. And the number one, thyroglobulin is synthesized and discharged into the follicular lumen. So the left side pink color is a follicular lumen, and the white color in the center right hand side, that is the colloid lumen of the follicle, and more left region is the where the blood supply is there, from which we will get the iodide. The blood containing iodide will be taken up by the follicles, the process of iodide trapping, and thyroglobulin is synthesized and discharged into the follicles into the lumen. So thyroglobulin will be released from the follicles itself, and that enters into the colloid region or lumen of the follicle. Okay, the process of thyroglobulin occurs with the presence of Golgi apparatus and in the rough endoplasmic reticulum. So iodide taken up by the follicles and oxidized to form the active form of iodine. This iodine also enters into the lumen, and after entering into the lumen, the iodine enters the follicle where it is attached to the tyrosine in colloid, forming diiodotyrosine and monoiodotyrosine. You can see the picture now. DIT, D means DI means diiodine, di means two iodine joined with one, and another one is 3 iodine joined with the one. So 2 diiodotyrosine joined to form T4, and 1 monoiodotyrosine and 1 diiodotyrosine joined to form T3. Okay, this is the process of the formation of the T3 and T4. 1 monoiodotyrosine and 1 diiodotyrosine joined to form T3. 2 diiodotyrosine joined to form T4. The T4 and T3 is a form of thyroid hormone. In this, 4 is a iodinated tyrosine. Iodinated tyrosine are linked together to form T3 and T4. Then the T3 and T4 comes out from the lumen, enters into the follicle again. Thyroglobin colloid is endocytosed and combined with the lysosome. Picture 5. And we can see the line within the lysosome, T3, T4 are present. The T3, T4 are present and they moves out into the blood again. From the blood only, iodide enters inside by the process of iodide trapping. After that, oxidation, then coupling and formation of T3, T4 and T3, T4 forms and enters inside the lysosome and that moves into the follicles, and then T3 will and T4 again will be releases into the blood circulation is called the release of T3 and T4. Finally, the lysosomal enzyme cleave T3 and T4 from the thyroglobin colloid and the hormones diffuses from follicle into bloodstream. Very clearly, the 6 points written here. So easily you can identify. So once again, I will repeat the synthesis of thyroid hormone. The first step of the formation is thyroglobulin, which is synthesized from the rough endoplasmic reticulum as well as the Golgi apparatus, and it will be releases into the colloid. And from the bloodstream, that food containing iodide enters the stomach, with absorbed into the blood. That blood goes into the also blood will goes into the heart and passes through the systemic circulation, through which the blood will supply to the thyroid gland also. So when it comes to the near to the thyroid gland, near the follicle, the iodide taken up by the second step called iodide trapping. Okay, that iodide will enter inside the follicle. After that, it gets oxidized to form active form of iodine. This active form of iodine will be forms as the diiodotyrosine and monoiodotyrosine. Two diiodotyrosine join to form T4, one monoiodotyrosine and one diiodotyrosine join to form T3. These T3 and T4 comes out from the lumen and endocytosed by the lysosome and enters into the endocytes by the lysosome and enters the bloodstream after releasing from the cleavings from the lysosomal enzyme and goes to the blood and supply to the all parts of the body. So this is the way the thyroid hormone reaches the all the cells to our body. Biosynthesis of iodine. So what I explained from the picture only repeating here, the follicular cells take up the iodide from the plasma by active transport explained, and thyroid stimulating hormones stimulate this process. The thyroid stimulating hormone releases from the pituitary gland, thyroid stimulating hormone, which stimulates the thyroid hormone to stimulate the T3, T4 or release the T3 and T4. Oxidation of the iodide into iodine. Iodine is oxidized to iodine by the peroxidase enzyme system. The iodination of the tyrosine is iodine is bound to tyrosine at the third position to form the monoiodotyrosine, simply called MIT. And then fifth position to form 3,5-diiodotyrosine simply known as DIT, diiodotyrosine. And the iodinated tyrosine to the tyrosine. Oxidative coupling of the 2-DIT forms the T4. Coupling of one DIT with one MIT forms the T4. Deiodination of the T3 and T4 will take place. and this coupling and condensation is catalyzed by the thyroid peroxidase enzyme. The small amount of reverse triiodothyronine, which is T3, 5 triiodothyronine is also formed the MIT and DIT. The MIT and DIT T3, T4 are peptide linkage thyroglobulin. Secretion thyroglobulin is not released as such into the blood, and release of thyroid hormones. Thyroid epithelial cells ingest the colloid endocytosis from the apical border, producing vacuoles in the colloid during activity. The colloid-laden endosomes fuse with lysosomes, which contain hydrolytic enzymes that digest the thyroglobulin, thereby liberating thyroid hormones. Release of thyroid hormone. The free thyroid hormone diffuses of the lysosomes through the basal plasma membrane into the blood. They quickly bind with to the carrier protein for transport to the target cell. The thyroid hormones are basically tyrosines linked together with the addition to iodine at third or fourth position on the aromatic rings. And the number and the position of the iodine is important. Calcitonin formed from the parafollicular cells. Release of thyroid hormone, already all the release, oxidation, formation, coupling, everything I have shown in that previous picture itself. Here also, this picture also shows the after forming the thyroid hormone from the colloid, the topmost layer is a colloid, through which process of endocytosis under the within the lysosome, the T3 and T4 carried and releases into the extracellular fluid, nothing but the bloodstream. And in the peripheral tissue, after reaching into the peripheral tissue through the blood, T4 is converted into more active iodothyronine T3, brought about a deiodination reaction. T4 more stable and act as a precursor or pre-hormone for T3. T3 is a more potent hormone than T4, but it has a shorter half-life. So T3 is more active than the T4, but the shorter half-life. Another conversion in the periphery, T4 is deiodinated into an inactive form RT3. The precise role of RT3 is not fully understood. It is thought to regulate the amount of active iodothyronine in the body. Okay, thyroid hormone combined with the proteins, mainly thyroid binding globulins, all thyroid binding globulin, simply called TBG. A small proportion also bind to albumin and pre-albumin, TBPA. Less than 1% are free unbound in the plasma. Estrogens increases the synthesis of binding of protein, and androgens, glucocorticoids, decreases the thyroid binding globulin. And this picture shows the regulation of the thyroid hormone. The above picture is a pituitary gland. From the hypothalamic releasing hormone reaches the thyroid gland. Thyroid gland releases what hormone released by hypothalamus? Hypothalamus releases the thyroid releasing hormone into the pituitary gland, especially anterior pituitary gland. Now the anterior pituitary gland releases the TSH, nothing but thyroid stimulating hormone, which goes to the thyroid gland, where it stimulates the secretion of the thyroid gland. There, Okay, this is the picture. And warm and cold control of the thyroid function. Hypothalamus, the cold environment will increases the positively increases the or stimulate the hypothalamus to release the thyroid releasing hormone to the pituitary gland, which further stimulate the release of thyroid stimulating hormone, and then which will reach the thyroid gland to stimulate the T3 T4, and warm will be decreases the entire process will be negative. Okay, so positively by the cold and negatively by the warm. Okay, so negative feedback and positive feedback will be present in this. Stimulation will be short loop inhibition, and long loop inhibition will be negative feedback. Okay. Then next is other regulators. Estrogen increases the thyroid stimulating hormone secretion, and increase iodide decreases the T3 T4. So if the iodide content increases in our body, T3 4, T3 and T4 will decrease as, therefore there will be an increase of thyroid stimulating hormone. Somatostatin, glucocorticoid, inhibits the thyroid secretion. Dopamine, that decreases the thyroid stimulating hormone. Actions of thyroid hormone. It acts via cyclic adenosine monophosphate and increases the proteolysis of the thyroglobulin within 30 minutes, and increase the iodide trapping and increase iodination. The iodide trapping and iodination and coupling may take hours or days. Okay, now essential growth and development. Effects of the thyroid hormone on growth and development. It is essential for normal growth, maturation, and differentiation of the skeleton, thyroid as well as the body. And thyroid hormone potentiates the effect of growth hormone necessary for the skeletal growth, maturation, and ossification of the cartilage. So, very, very important for the growth of the body along with the growth hormone. And skeletal system, it will increase the length of the bone. Optimal thyroxine level is necessary for efficient muscle function. There is a muscle weakness both in hypo and hyperthyroidism. So there should not be excess thyroid hormone or it should not be a less thyroid hormone. Both will affect our body. And calorigenic action. This is the major and first function of the thyroid hormone based on priority based. T3 increases the basal metabolic rate almost all the cells in the body except brain, gonads, spleen, lungs, and accessory sex organ. Normal basal metabolic rate in adult is 35 to 40 kilocalorie per meter square BSA per hour. So, oxygen consumption and heat production is due to increase in sodium potassium ATPase activity and increase in size and number of mitochondria. Okay, this is a major BMR, basal metabolic rate, also called calorigenic action, caused only mainly by the thyroid hormone, and the effect of thyroid hormone on the carbohydrate metabolism. Two effects that balances each other. One is it increases the peripheral utilization of the glucose like insulin. Okay, hypoglycemia. So thyroid hormone may produces the hypoglycemia. If it is excess, and it also increases the blood glucose level, hyperglycemia. Increase intestinal absorption of the glucose, increase glycogenolysis, and increase neoglucogenesis. All these three functions are metabolism of the carbohydrate are done by the thyroid hormone. The complex carbohydrates provides the vitamins, minerals, and fiber. Food like such as the bread, and rice, pasta, starchy vegetable contain complex carbohydrate, which will be utilized with the presence or help of thyroid hormone. Protein metabolism. Catabolic in pharmacological doses. Catabolic effect on muscle and myopathy weakness. On bone, anabolic in physiological doses. Okay, and as well as the osteoporosis. So catabolic in pharmacological doses means what? There will be a protein usage and catabolism of protein will take place and causes the development of the muscles normally. If the excess will causes the muscle myopathy and the weakness, and excess dose will be produces the osteoporosis. So for the normal maintenance protein, the thyroid should be in a normal level. And lipid metabolism lowers the circulating cholesterol level. Thyroid hormone will decreases the cholesterol level by increase the excretion of the cholesterol in the bile, and hypothyroidism increases the plasma flow. So if the thyroid hormone not secreted, there will be a increased cholesterol level in the plasma. Hyperthyroidism decreases the plasma cholesterol. So both should not be happen. The cholesterol level should be maintained in the normal range. Okay. And on vitamins, the thyroid hormone is necessary for the conversions of the carotene of vitamin A into in liver, and necessary for the conversion of carotene to vitamin A in liver. In hypothyroidism, there is a carotenemia, giving rise to a yellow color of the skin and effect on CNS, essential to the development of the fetal and neonatal brain due to the potentiation of their catecholamine activity. In childhood, deficiency, defective myelination, and development of the dendrites decreases, which will lead to the mental retardation. In adult deficiency, leads to decrease the electrical activity of the brain, memory loss, mental lethargy, and myxedema, madness, dullness will be there. All the parameters will be decreases, blood glucose level and protein will be accumulates more, cholesterol will be accumulates more, glucose and protein will decreases. Glucose decreases, but cholesterol increases, and bradycardia will shown, and overall activity of the body decreases. Always the person look like tired and dull, and the face look like edema, so that is myxedema and madness. On cardiovascular system, the effect of thyroid hormone, which will increases the heart rate and force of contraction and cardiac output and systolic blood pressure due to increase the beta adrenergic receptors, which is increased sensitivity of heart to catecholamines, increase the production of the myosin with high ATPase activity, and decreases the peripheral resistance and hence decrease diastolic blood pressure. Diastolic blood pressure will be decreased. Okay, then next, reproductive system. Optimal amount is necessary for the normal gonadal function. Thyroid hormone in women decreases, leads to menorrhagia, amenorrhea, and loss of libido. In men, loss of libido. Thyroid hormone increases in women, leads to oligomenorrhea and amenorrhea. In men, impotence. So it is very, very, very important to maintain normal level in our body. On gastrointestinal system, normal levels of T4 is necessary for normal function of the digestive system. Hyperthyroidism leads to diarrhea and increased appetite. So what happened? In case of hyperthyroidism, there will be a movements will be more. So there will be a frequent elimination of the fecal matter. So increase diarrhea. So at the same time, due to the evacuation of the food from the gastrointestinal tract, there will be a appetite increase will be seen. And in hypothyroidism, just opposite reaction will take when compared to the hyperthyroidism. Here will be a constipation, means fecal movement will not be, bowel movement will not be regular. Okay, total disturbed become constipation. And due to this constipation, movements and disturbed appetite will not be there. So decreases the appetite. And test for the thyroid function. Determination of the serum T3, T4 and thyroid stimulating hormone. And so when the person or patient suspect with the having the thyroid problem, have to undergo the testing the serum T3, T4 and TSH. And also another method, measurement of protein bound iodine PBI, and as well as radioactive iodine uptake. And to check the basal metabolic rate, and I already told if it is less, there will be increased cholesterol. If it is more, there will be a decreased cholesterol. So by looking the serum cholesterol also, we can identify the thyroid hormone excess or low. And hypothyroidism in adult is known as myxedema. You can see this patient or subject, the eyelids, lower eyelids bulged. Most common, and this will be most common in women, maybe in autoimmune disease. Okay, so thyroid disease, hypothyroidism, myxedema may be an autoimmune disease. What are the reasons for the autoimmune disease? Iodine deficiency and pituitary disorder. Features of this disease: buffy face, eyelids are baggy. This picture shows the eyelids are baggy, and upper eyelid droop, that is a ptosis, loss of tone in the upper eyelid, and periorbital edema. You can look this person, periorbital edema will be visible, and edema and of hands and feet, deposition of fluid with the mucoprotein, and obesity. Also, along with there will be a weight gain and dryness in the skin, porous, scaly, and increased sensitivity to the cold, excessive loss of air, outer third of the eyebrow and scalp. Okay, excessive loss of air, outer third of the eyebrow and scalp. Okay, these are the most common in the women, in the adult. Decrease in the other difficulties in the myxedema, decrease in the mental activity, slowness of the thought and speech, slow cerebration. Memory is impaired, voice will be hoarse, and lethargy, muscular weakness and fatigability, slow pulse, low blood pressure, and heart may be dilated. And the electrocardiogram wave shows the low potential waves. Anemia will be present and sexual functions will be depressed. Cretinism. This will happen in infants with hypothyroidism, or if the infants have the less thyroid hormone, the condition is called cretinism. Child may be normal at birth. Effects appear within a week. milestones of development delayed. Sorry, all the milestones of the development delayed cause maternal iodine deficiency. Features of the cretinism: dwarfism means nothing but stunted growth. In the pituitary dwarfism also there will be a stunted growth. In thyroid dwarfism also stunted growth. But the difference is pituitary dwarf people will be mentally normal. Mentally they are normal. Here the cretinism person look like short as well as mentally growth, stunted growth. Not only stunted growth, mentally also they are affected. Gross retardation of the mental growth, failure of sexual development, pot belly, protruding thick tongue, and broad nose with depressed bridge, skin was scanty hair, decreased basal metabolic rate, and as well as increases the cholesterol, and there will be a decrease of T3 and T4. Early detection and treatment necessary in case of infantile hypothyroidism. These are the picture shows the cretinism baby. See the baby not able to stand properly. With some stick help only baby can stand properly, otherwise the baby cannot stand. And you can see the baldness present in the baby and the stupidness, dribbling of saliva, dullness, everything will be appeared in the picture itself. Poor posture, pot belly, all the features are present. Hyperthyroidism, toxic goiter, thyrotoxicosis, Graves' disease, all comes under the hyperthyroidism. Reason for hyperthyroidism are primary thyroid tumor and secondary thyroid stimulating hormone secreting pituitary tumor. So tumor in the thyroid, maybe the problem with the thyroid gland itself or the thyroid stimulating hormone secreting pituitary tumor, and laterogenic administration of the T3, T4. And as already I told, autoimmune disorders, maybe they also may for the reason for hyperthyroidism as well as hypothyroidism. And thyroid stimulating immunoglobulin, TSI, and long-acting thyroid stimulator, LANTs, and thyroid receptor stimulating antibody, TSHR, stimulating antibody. Okay, these are the causes for the hyperthyroidism. So this picture shows both hypo and hyperthyroidism regulation. The left hand side, hypothyroidism due to the low iodine. See, low iodine in the diet decreases T3, T4. Therefore, hypothalamus will increases the thyroid releasing hormone. That goes to the from the anterior pituitary, which will stimulate the increased thyroid stimulating. Thyroid gland enlarge, no iodine, decreased T3, T4, no feedback. And hyperthyroidism due to the Graves' disease. Hypothalamus decreases thyroid inhibited due to the Graves' disease. So decrease the release of thyroid releasing hormone from the hypothalamus. No stimulus to the anterior pituitary. Anterior pituitary also will not stimulate the thyroid stimulating hormone or will not release the thyroid stimulating hormone. Thyroid gland again begins to enlarge. There will be increased T3 and T4. Okay, increased T3, T4. Again, strong stimulus goes, again further stops. So it is a strong negative feedback mechanism. So in the hyperthyroidism, there will be a strong feedback mechanism. In the hypothyroidism, there is no negative feedback mechanism due to the low iodine content. Features: mild to extreme weight loss, fine tremor of hands, exophthalmos, and cardiovascular system shows the increase in heart rate, increased sleeping pulse rate, high output failure, and increased pulse pressure, decrease the peripheral resistance due to the vasodilation. Respiratory system shows the increased pulmonary ventilation, and GIT shows the diarrhea. I already told increased thyroid hormone leads to diarrhea and increased appetite. And CNS increase the excitability, nervousness, loss of sleep, anxiety. In case of hyperthyroidism, when compared to the hypothyroidism, in the hypothyroidism, opposite action, dullness, okay, prone to sleep and lethargic. Features continuing for the hyperthyroidism: skin become warm and moist, heat intolerance, sweating will be more, thyrotoxic myopathy, muscular weakness, fatigue and osteoporosis, vitamin deficiency. All these are features of the hyperthyroidism. And exophthalmos protrusion of the eyeball. Eyeball will come out a little bit out from the orbit. Strange look, wide open eyes, sclera is seen above the cornea, and severe cases, stretching of the optic nerve, loss of vision. Damage of the eye because they cannot close the eye. Causes swelling of the retroorbital tissue and degenerative changes of the extraocular muscles due to the thyroid stimulating inhibitory action. TSI action. Goiter, swelling in the neck, enlargement of the thyroid gland, symptomless, simple goiter due to the iodine deficiency, occurs in mountain dweller, endemic goiter. Hypofunction, inadequate, iodine decreases T3, T4 and increases the thyroid stimulating hormone. Goitrogens, Brassica family, garbage, tonic and anti-thyroid drugs. Okay, will cause the goitrogens. Investigations, hypothyroidism by checking the BMR. BMR will be less and TSH will be more, T3, T4 less, serum cholesterol increases, serum PBI decreases, anti-thyroglobulin antibodies may be present. Hyperthyroidism, BMR increases up to 100, decreases TSH, increase T3, T4, decrease cholesterol level in serum and serum PBI, and increases the blood glucose. Anti-thyroid drugs, inhibiting trapping of the iodide by competitive inhibition, okay, and thiosinate perchlorate will be inhibit the iodide trapping, inhibit the excitation, binding and coupling of the iodine, methyl propyl thiouracil carbamidazole. Iodines in large amounts have antithyroid effects. Inhibits the binding of iodine, inhibits the effects of thyroid stimulating hormone of the gland, diminishes the release of the hormone. Beta-adrenergic blockers in hyperthyroidism. That's all about the thyroid gland. So finally, the small conclusion about the thyroid gland, which is very essential for the growth and functions of the body and the sexual final maturation of the sexual system only by the thyroid hormone, and the CNS development mainly by the thyroid hormone by causing the myelinogenesis of the fiber will be mainly by the presence of the hormone thyroid. So this is also known as myelinogenetic hormone. Nerve system, CNS developing hormone. Okay, and it also responsible for the basal metabolic rate, and it is also responsible for the increase the calorigenic production and differentiation of the male and female sex sexual differentiation mainly by the thyroid hormone, growth by the growth of the bone, organ, etc. by the growth hormone, but final maturation only by the thyroid hormone. So thyroid hormone plays very important role in our body, and in all the system, the thyroid hormone action is a very unique and interesting. So to keep or to maintain the thyroid hormone normal level, those who are having normal and people with normal thyroid level, to maintain the normal thyroid level, they should follow or they should follow the regular exercise and proper food intake, which will maintain the thyroid hormone level in our body normally. So we'll keep our thyroid hormone level normal, and we'll keep our health. Thank you all. Thank you so much.
இன்னும் பண்ணலையா?
பண்ணி முடிச்சுட்டு அது க்ளோஸ் ஆக மாட்டேங்குது. இங்கே வரவும் என்பிடி போடுற ட்ரை பண்ணுறோம் வர மாட்டேங்குது.
நெட் இருக்கா?
நெட்டு வர மாட்டேங்குது.
நீங்க என்ன பண்ணீங்கன்னு தெரியல.
ஒன்றுமே பண்ணல. முடிச்சுட்டு இங்கே இதில் இருக்குமா எல்லாம் க்ளோஸ் பண்ணலாம் வர மாட்டேங்குது. இந்த பேண்ட் தான் வருது.
சரி விடுங்க பார்த்துக்கலாம்.
இப்போ ரெக்கார்டிங் கம்மி ஆகிட்டாங்க. பிளாக் பண்ணிட்டாங்க. ஆச்சா இல்லையானே தெரியல. ஆனால் ஆச்சு, கண்டிப்பாக ஆச்சு. க்ளோஸ் பண்ணணும் வெயிட் பண்ணுறோம். வரவே மாட்டேங்குது ஆப்ஷன்.
தெரியலையா? நீங்க என்ன பண்ணிருக்கீங்க?
எல்லாம் பண்ணி வச்சுட்டேன்.
நான் பாத்துக்கிறேன். போனீங்க
நான் அதுக்கப்புறம் 2 தடவை ட்ரையல் கூட பார்த்துட்டேன். இந்த பாருங்க மேலே போனால் இப்படி பண்ணால் வரும்ல. ஒன்றுமே பண்ண முடியாது. பண்ண முடியாது. மீட்டிங் மைக்ரோஃபோன் இதுவா இது வேற லதா குமார்னு வருது. வேற போகுது. என்ன ஒண்ணுமே வர மாட்டேங்குது. ஒண்ணு இதாவது போகணும், அதுவும் வர மாட்டேங்குது. அப்படியே அப்படிதான். நீங்க மேல போனா ஒரு இது காட்டும்ல. வருது recording was not converted ஓகேவா converting the following files may put your device and personal data at risk.